This video is a guide to correct way of self-injecting SemaVin pen. Please watch the complete video before using SemaVin pen to ensure maximum safety and efficacy during your treatment. Let us see all the components before we begin. Open the SemaVin carton. Inside, you will find one pen, 5 needles and 5 alcohol swabs. This is pen cap, cartridge holder, cartridge, dose window, dose knob, injection button, flow check symbol, paper tab, needle, inner needle cap, outer needle cap. Remove the pen and check the label carefully. Make sure it matches with the dose prescribed by your doctor. Using the SemaVin pen is simple and easy. Just follow these 5 steps. Step 1. Preparation. Before preparing to inject yourself, wash your hand thoroughly with soap and ensure that you have SemaVin pen, needle and alcohol swab with you. First, check the solution through the pen window. It should be clear and colorless. If it looks cloudy or colored, do not use the pen. Now take a needle. Remove the paper tab. Push it onto the pen and turn until it is tight. Pull off the outer cap and keep it for later. You will need it after the injection to safely remove the needle from the pen, and now remove the inner cap. A drop of solution may appear at the needle tip. This is normal, but you must still check the flow if you use a new pen for the first time. Always use a new needle for each injection. Never share your needle or pen to avoid the risk of infection. Step 2. Flow checking. Since this is a new pen, flow checking is important. Always perform flow checking before the first injection of every new pen. Hold the pen body, turn the dose knob clockwise to the flow check symbol right past 0. Make sure the flow check symbol lines up with the pointer. Hold the pen with the needle pointing upward. Tap the injection pen gently to gather air bubbles to the top. While still holding vertically, press and hold the injection button until you feel a click and the dose counter returns to 0. The 0 must line up with the dose pointer. A drop of solution should appear at the needle tip. A small drop may remain at the needle tip, but it will not be injected. This means your pen is ready. If no drop appears, repeat the flow check steps up to 6 times. If needed, change the needle and try once more. If there is still no drop, safely dispose of the pen and use a new one. Step 3. Dose selection. Rotate the dose knob clockwise and keep rotating until the dose counter stops and shows the dose. Now put a side pen on clean flat surface. Take care not to touch the needle anywhere. Step 4. Inject the dose. Choose your injection site as guided by doctor and clean the skin with an alcohol swab. Let the area dry before injecting. Pinch to raise your skin a bit and insert the needle into your skin as your doctor or educator has shown you. Make sure the dose counter is visible. Do not cover it with your fingers. This could interrupt the injection. Continue pressing the injection button while keeping the needle in your skin. Count slowly to 6. While keeping the injection button pressed till the dose counter reaches to 0. When the counter returns to 0, remove the needle from your skin. You may see a drop of solution at the needle tip after injecting. This is normal and does not affect your dose. Step 5. After injection. After the injection, do not put the inner cap back on the needle. Place the outer needle cap on a flat surface and carefully guide the needle into it. Once covered, unscrew the needle and dispose of it safely. Always remove the needle after use. Put the pen cap back on to protect the solution from light. Ideally, store the pen in the rack on the fridge door. Do not refrigerate by placing in the freezer. For the next dose, wash your hands and take your pen out of the fridge. Attach a new needle. Turn the dose knob until it locks at your dose. Clean and prepare your skin. Go ahead and inject dose as you have done before. For any further information, please contact your doctor.